Hello, welcome to any community. In this particular video, we are going to discuss one of the pariksha which is being explained in the context of pratyaksha, that is Rasanendriya Pariksha. This is very specific in nature, or typical in nature, because here the Rasanendriya of the clinician is not being used. Here, the any information related to the Rasanendriya, etc., that are going to get inferred. So that means the Anumana Pramana or Anumana or inference that is being used in this particular occasion. So, what is the description that is being mentioned in the text in the context of Rasanendriya Pariksha? We are going to discuss today. When you think about Rasanendriyataha Pariksha, text says, regarding the Charaka Samhita, in Vimanasthana 4th chapter, that is being mentioned that प्रत्यक्षतस्तु खलु रोगतत्त्वं बुभुत्सुः सर्वैरिन्द्रियैः सर्वान् इन्द्रियार्थान् आतुरशरीरगतान् परीक्षेत अन्यत्र रसज्ञानात् तु खलु आतुरशरीरगतमिन्द्रियवैषयिकम् अपि अनुमानात् अवगच्छेत न ह्यस्य प्रत्यक्षेण ग्रहणम् उपपद्यते तस्मात् आतुरपरिप्रश्नेनैव आतुरमुखरसं विद्यात् युकर अपसर्पणेन त्वस्य शरीरवैरस्यं मक्षिकोपसर्पणेन शरीरमाधुर्यं लोहितपित्ते सन्धेः तु किं धारिलोहितं लोहितपित्तं वा इति श्वकाकभक्षणात् धारिलोहितम् अभक्षणात् लोहितपित्तम् इति अनुमातव्यम् एवम् अन्यानि अप्यातुरशरीरगतान् रसान् अनुमिमेत. So that is being mentioned in Charaka's Vimanasthana 4th chapter. If you spread this particular shloka, Pratyakshataha tu khalu rogatatvam bubhutsuhu sarvaihi indriyaihi sarvan indriyarthan atura shariragatan pariksheta anyatra rasadnyanat rasam tu khalu आतुरशरीरगतान् इन्द्रियवैषयिकम् अपि अनुमानात् अवगच्छेत न हि अस्य प्रत्यक्षेण ग्रहणम् उच्यते तस्मात् आतुरपरिप्रश्नेन एव आतुरमुखरसं विद्यात् यूक अपसर्पणेन तु अस्य शरीरवैरस्यं मक्षिका उपसर्पणेन शरीरमाधुर्यं लोहितपित्तसन्धेहे तु किं लोहितपित्तं वा इति श्वकाकभक्षणात् धारिलोहितम् अभक्षणात् लोहितपित्तम् इति अनुमातव्यम् एवम् अन्यानि अपि आतुरशरीरगतान् रसान् अनुमिमीत. Further, it is being mentioned that Chakrapani Yuka Apasarpanena Sharira Vairasyam iti Virasad hi Sharira Dayaha Sharirad Yuka Apasarpanti Eva Yukadi Anapasarpanena Prakrita Rasayuktam Shariram Anumatavyam Dharilohitam iti जीवशोणितम् इत्यर्थः भक्षणादि ज्ञेयं यद् धारी रक्तं तद् पित्त दुष्टत्वेन अविरसं श्वादयो भक्षयन्ति न तु पित्तदुष्टं रक्तपित्तम् इति भावः. If you look into this particular aspect, pratyaksha, that is usually we are going to use the indriya of the clinician. So here the rasadnyanat, so rasanendriya of the clinician is not being used. For that, inference or anumana pramana will be used. So that is inference in the sense we are going to interact with the patient, interrogate with the patient regarding the abnormal taste perception. For example, if the person is having sore eructation, so that means the person is having Amla Pitta. If the person is having Tikta Odgara or Tikta Amlodgara, then we are going to say the person is having Urdhvaga Amla Pitta. In that way, so Athura Mukharasam Vidyat. So that is, we are going to interact with the patient and thereby we are going to say the person is having this particular disease as such. Further, it is being mentioned that Yuka Apasarpanena. So the Yuka in the sense that head lies. Apasarpanena, if they are moving away from the body, that is indicative of Vairasya. That means the body is not having the pleasant, what do you say, that the rasa in that. Makshika upasarpanena, sharira madhuryam. In the sense, if the flies are moving towards the human body, that is indicative of a sweetness of the human body. That means the person may be having madhumeha, or the person may be having, what do you say, that the sharira madhuryata. When the person is having bleeding tendency, there may be a possibility that the person will be having the thari pittam, in the sense, or thari lohitam, in the sense the normally functioning rakta dhatu, or otherwise the person is having lohita pittam, the person is suffering from the rakta pitta disease. How we are going to differentiate these two? So this is being actually practiced in the olden days, because the newer technology of what is the diagnosing this were not available. When the person is having this particular the blood acid, if that is mixed with the food which will be given to the shwa, or the what do you say, that the dogs or crow, at that particular time, if the dogs or crow eat that particular food substance, then that is indicative of the person is suffering from, what do you say, that the dhari lohitam, that is normally functioning rakta dhatu that is being coming out from the body. If these shwa and kaka, that is dogs or crow, if they are not eating that particular food substance, that is indicative that the person is suffering from the rakta pitta. This is what we can say, what is that the diagnostic tool in this as such. So this has to be considered in other conditions also. So that is being mentioned in this particular aspect. The Chakrapani commentary, Yuka apasarpanena sharira vairasyam. So that means Yuka apasarpana, if the head lice are moving away, that has to be considered the body is having the vairasya. Sharira is having vairasya. Yuka anapasarpanena, if the head lice are not moving away from the body, that is indicative that the person is having the prakrita rasayukta. So this is what is considered to be the description available in Charaka Samhita. Whereas textual description available in Sushruta Samhita. Rasanendriya Vidnyayaha Pramehadishu Rasavisheshaha. So Rasanendriya Vidnyayaha Pramehadishu Rasavisheshaha. So that is Rasanendriya Vidnyayaha. So the informations which are being diagnosed by Rasanendriya, specifically that are considered to be helpful in the diagnosis of Prameha. So here that is being mentioned that Nanu Pramehadishu Rasa Madhuradayo Makshika Pipelikadi Upasarpanena Bishakbi Nanumeyaha Tat Katham Rasanendriya Vidnaya iti Uchate Natra Bhishajam Rasanendriyam Kintu Pipilikadinam iti Adoshaha. So if you split this, Nanu Pramehadishu Rasa Madhura Adayo Makshika Pipilika Adi Upasarpanena Bishakbihi Anumeyaha Tat Katham Rasana Indriya Vidnyaya iti Uchyate Na Atra Bishajam Rasana Indriyam Kintu Pipilikadinam iti Adoshaha. The Sushruta Samhita says, Pramehadishu Rasa Madhuradayo Makshika Pipilikadi Upasarpanena Bishakbihi, that is, the wise clinicians will make the diagnosis that the person is having sweetish taste inside the body by seeing the makshika, that is the flies, or pipilika, that is what we can say the ants, if they are moving towards the patient's body, then we are going to say the person is having prameha, etc. But here, how we are going to say Rasanendriya Vidnyayaha? So this is considered to be the visible outside the human body. How we are going to say Rasanendriya Janya Jnana? So here Uchyate, that is being told that Bishajam Rasanendriyam na atra. So that is Rasanendriya of the Bishajam, that is clinicians are not being used, but Rasanendriya of the Pipilikadis, etc. are being considered in this particular occasion. This is the description available in Sushruta Samhita. So regarding the Pipilika Abhisarana, in the sense, if you are looking into if the person is doing the micturition somewhere here, if you are getting the ants moving towards this particular side, that is indicative that the person who did the micturition, that is indicative that the person is suffering from the prameha or madhumeha. So when you think about the makshika apasarpana, if they are moving away from the body, that is indicative that the person is having some kind of the sharira vairasya. So that is abnormal rasa, that is actually making the flies to move away from the body. So that is what is considered to be the description available in textbooks. Take-home messages from today's discussion are Rasanendriya. It is the one type of the Pratyaksha Pariksha which is practiced by Anumana only. So here the Rasanendriya of the clinician is not used. As per the Dallana commentary, it is being mentioned that Rasanendriya of the animals, such as the ants, etc., that are considered in this particular occasion. The diagnosis can be done in this particular occasion. It could be either Madhumeha or Sharira Vairasya or Ratta Pitta, etc. can be diagnosed with this type of Pratyaksha Pariksha, where inference or Anumana Pramana or Anumana Pariksha is being practiced. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.